The frontline workers and among the people who have been key in informing the country about what to do, when to do it, is Dr. Githinji, the Chief Executive Officer at Amref Health Africa. And he now joins us to just tell us the steps that the country has taken and what is the way forward. Thank you for joining us. So it's been a year now. What lessons has the country learned? What lessons has the continent learned?
Well, it's been a year now. And the lesson that we've learned is that pandemic preparedness is a health system resilience matter. You can never prepare for a pandemic. The only way to prepare for one is to ensure that your health system is resilient enough to respond when one arises. And resilience means being able to absorb the shock that is demanded by the pandemic. We saw from the time we started, we needed more beds for ICU because the demand was increasing. We needed more beds for HDU. We needed more health workers. The countries across Africa and in Kenya had to employ more health workers to the health system to respond to the pandemic. We noticed that one of the rarest commodities and one that is essential was not in good supply. That's oxygen. We couldn't find oxygen to make people breathe. And many people actually died looking for beds that could have saved their lives if they have adequate oxygen. So we have learned that one of the biggest lessons is for us to prepare for the next pandemic. We must build the health system. We cannot wait to respond during the emergency. So that's one big lesson, and I believe that our governments across the continent have learned that. Secondly, that institutions are important. Institutions are important. We saw very early on the Africa CDC in Addis Ababa respond and take front stage in the leadership of the pandemic and mobilize resources for PPEs, mobilize health workers and governments for policy change to respond to the pandemic. We saw them hosting multiple meetings, working together with WHO, Afro, building capacity for testing. Some of the very early tests that were used in Africa came from Africa CDC and WHO Afro. Institutions are important. They are critical for Africa and countries to build. So these are the lessons we've learned. And also, the final lesson I want to talk about here is that there is nothing that takes priority over community engagement and mobilization. That originally when we started the response, we saw a lot of government-led instructions, government-led guidelines. But actually, what we've seen over time is that whenever communities were engaged first and they owned the response, the government then gave the leadership to complement community efforts. We saw people refuse to wear masks, refuse to obey curfew, and the police coming in. There was a lot of police brutality, abuse of human rights, and all that was not because the government desired to do so. It was because there was a failure of the first important step in community engagement and mobilization.
And the most interesting maybe for the continent is that we closed our borders early, whether it is Kenya, whether it is Uganda, and we remained inside. We remained locked out and, isolated ourselves. Do you think we were proactive enough? Maybe that's why the numbers have remained low on the continent?
Africa had the chance to learn. We were watching the unfolding pandemic in other countries. And governments, if you remember very clearly, in many of the countries, including Kenya, presidential declarations creating national steering committees at cabinet level were created in February, even before the first case came. So that preparedness was actually important in holding the force of transmission. As we keep saying, what's really important is the speed and force of transmission. If the borders were not closed early, then the force of transmission would have been higher. We would have had actually more deaths and more sick people when we were not prepared. So early closure of borders assisted the countries to then say, fine, now we've held back some of the infection. We know they're already in the country, but can we buy time to build oxygen supply, to build health worker training, to build community health worker training, to put more ICU beds and isolation centers? So that bought us that time. So even later when the COVID virus was spreading, we had actually bought ourselves time to prepare.
And we are used on this side of the region. If we are unwell, if our leaders are unwell, they run to South Africa, they run to London. This time, you had to stay with your sick person at home.
Yes, sir. Because you see, this was actually an irony that for a very long time we talk about the need to strengthen the health system, the combined public and private health system together, not one or the other. And this is a need for all of us. If one of us is not safe, none of us is safe. And the politicians and the leaders notice that actually it was important to have built the local health system. In fact, I had very early on reports saying some politicians had actually bought their own oxygen machines in their houses. They had actually bought ventilators in their houses. Why? Is it because they didn't trust the health system? It's very important for us to use this moment to reflect on what kind of health investments are needed to improve our health system, both public and private, so that we can protect each one of us, whether rich or poor.
Sadly, the ugly head of, selfishness and self-centeredness reared its ugly head. We had cases of COVID billionaires in Kenya, in South Africa, in Malawi, in Uganda. Don't we learn?
I think humanity is greedy, and that's really a bad lesson. Even now, let us extend that conversation to vaccines. We discussed very early on, and the world was clear on one voice, that we want vaccine equity globally. But we have seen when the vaccines were available, people said, we want vaccine equity globally, but as long as we have vaccinated our people. This is the problem. Inward looking, individually, communities, as a country, as continents, and this is something that we have learned over free market capitalism. That actually the more you advance over your neighbor, the better you are, which is actually not true, because the more you work with people, the further you go together. And I think when we talk about pandemics, no single person is safe if another one is not safe. So within the country, when we look at people trying to profiteer from tests, for example, from PPEs, it is unfortunate. It is free market capitalism ideologies that sometimes actually must be checked by government regulation, government audits, and all these kind of things. So we truly believe that we can have an equal society if all of us follow proper accountability mechanisms that are supervised by government and civil society together.
And finally, that's where we will end, on the issue of the fact that it's barely a year and we too are on the same line with the others. We are vaccinating our populations. What have we done right this time? And I would like you to refer to the efforts we saw at the African Union level.
So what has happened is that globally, there has been a huge effort for the last 1 year to ensure that everyone has access to a vaccine, a safe and efficacious vaccine. We have had a lot of research and development going on globally, and Africa Union and Africa CDC involved in some of the research. The AstraZeneca vaccine introduced in Kenya today is actually a vaccine out of the efforts of global research and trials. Some of the trials were done in Africa, including Kenya. Now, secondly, there was the issue of regulatory efforts to ensure that the vaccine, because it's still in development, which stringent regulatory authorities work together to ensure that not every country has to go through the process of regulation for each vaccine. And WHO, Africa CDC have issued advisories to countries to say, this has been checked, this is now emergency use authorized, go through your process, but we can give you this backup, this assurance. That has been extremely useful. Finally, is about supply chain. That actually initially countries like Kenya were struggling with. Where do we find the vaccines from? But we saw WHO, we saw UNICEF, Gavi, and CEPI and others come together and say, just like we raise money for childhood vaccines, we are going to raise money for COVID-19 vaccine. And they have raised, and the target is to raise 2 billion doses to distribute to countries that are eligible for support on vaccines. And Kenya is one of them. And this is the reason why we've actually received our first doses. Because initially there were challenges of supply chain. No country was able to just go and buy its own vaccines. And other than the developed countries that had actually made what we call advanced market commitments from the manufacturers, some of them, like the US government, UK government, put in money into the research and development, and therefore that giving them a right of ownership of the product of that research and development. But Africa has benefited from what we call the COVID vaccine facility, headed by WHO and Gavi, supported by UNICEF and Africa CDC and others, to ensure that vaccines land. And more recently, we've seen the Africa Union also make sure that we can actually access over up to 270 million doses that can be purchased by African governments, and conserving those as an advanced market commitment by Africa Union, so that governments that want to put some money to purchase their own doses can access using that pipeline. So these have been global efforts, and this is why you can never talk of nationalism without strengthening multilateralism. Moving ahead, we must continue to look at equity. Equity is critical to everything we do. Even when we are discussing vaccines, we are discussing who accesses them first. Is it the one who can afford or the one who needs it? This is why countries are starting with prioritization groups. When you talk about health, in Africa, millions of people get poor every year because of paying health costs. Yet, health is the only thing you cannot live without. You can live without education, you can live without money, but you cannot live without health. So it is a fundamental human right, and we must think moving forward, how do we ensure that the achievement of universal health coverage as a right for all people is actually achieved.
So there you have it. It's been a year of pain, a year of loss, but also a year of great lessons, not just for the world, but for the continent. I don't know how you rate the continent on a rate of 1 to 10. I'll tell you, I think the continent has done well. We could have done better in some areas, but in it, there are lessons. From Nairobi at the Kenyatta National Hospital, for SABC News, my name is Sarah Kemani.